I'm ready.
With this, the US began its COVID-19 vaccine rollout on December 14th. The US said it hoped to vaccinate 20 million Americans by December end. But reality turned out to be quite different. By Jan 5th, only 4.8 million people were vaccinated and only 17 million doses were shipped so far. What caused delays in US's COVID-19 vaccine rollout?
Slow starts are not uncommon when you have a brand new program that you're starting to get off the ground, in all fairness. And also, it was launched right in the middle of the holiday season of Christmas and New Year's, in which many of the clinics were not at full operational capacity during that time. So I would think if we look at what happens in the next week to a week and a half towards mid-January, I hope we regain the momentum.
Although the Trump administration was praised for fast-tracking its vaccine program, it has come under fire for its execution. The Trump government had declined an offer from Pfizer to secure 500 million additional vaccine doses. With the delay, Pfizer may not be able to deliver more than the initial agreement of 100 million doses before June. Pfizer also alleged that millions of doses were sitting in warehouses because the government hadn't provided shipping instructions. This could cause a massive wastage of resources as Pfizer vaccines lose their efficacy after 30 days. The Biden administration, on the other hand, hopes to accelerate the process by invoking the Defense Production Act. This would help ramp up vaccine manufacturing, deploy mobile vaccination units, and push for more funding. The federal system of the US government has also caused some confusion. The White House says their responsibility ends after the vaccine doses are delivered to the states. State governments say they don't have enough money to distribute and administer these vaccines. The states informed the US Congress that they need $8.4 billion for training, record-keeping, staffing, and communications. The Trump administration has allocated only $340 million. However, the US recently passed a $900 billion COVID-19 relief bill, which sets aside $8 billion for vaccine distribution. Health workers are hopeful that the new fund will boost vaccination efforts. UK's vaccine rollout strategy. Britain has already vaccinated over 1 million people. It began use of both the Pfizer-BioNTech vaccine as well as the Oxford-AstraZeneca vaccine. It aims to administer 2 million doses of the Oxford vaccine a week by the end of January. But red tape and a lack of backup stocks have affected the efficiency of the rollout. This comes as COVID-19 cases in the UK continue to surge, reporting 50,000 new cases for 6 days in a row. What is causing a delay in UK vaccine rollout? Currently, there's a lack of vaccinators in the UK, and there are complaints of red tape in recruiting retired doctors and nurses for the job, who also have to undergo extensive training before being accredited. There is also a delay reported in the safety check of vaccine batches, which is taking up to 20 days. The UK government has said it will prioritise giving the vaccine in a series of 2 vaccine doses to as many people as possible first, before administering a second dose after a gap of 12 weeks. This decision has been criticised by the British Medical Association, which said that priority must be given to the most vulnerable population, rather than looking at achieving targets. The UK's chief medical officers defended the decision, saying most of the protection came from the first jab. MPs have also been asking the Boris Johnson government for more transparency on the available doses and schedule for vaccinating those at risk. The UK plans to vaccinate over 13 million people by 15th Feb, which many are now seeing as a distant dream. India's vaccine rollout plan. Meanwhile, the Union Health Ministry said that stakeholders at the centre and state were prepared to roll out the mass immunisation programme against COVID-19 within 10 days. India conducted the dry runs in 286 session sites and examined the operationalisation of SOPs and protocols.